let's talk about the most primary and immediate concern in the Parkinson's population. That would be falls. People with Parkinson's are at a much higher risk of falls and getting injured. As a matter of fact, not to scare you, but statistically, the number one cause of mortality or death in the Parkinson's population are complications from a fall. The number two cause of death or mortality statistically are complications from breathing issues or upper respiratory issues. For example, patients with Parkinson's are at a risk for pulmonary complications as a consequence of both the underlying disease pathology and side effects of medication. The degeneration of the substantia nigra and the subsequent loss of dopaminergic neurons can produce changes in ventilatory parameters. And this upper airway obstruction, if you will, and this chest wall restriction or rigidity in the chest, these are both very common. All right, so let's think about an example of how complications from a fall could maybe cause a prolonged hospital stay or maybe even death, very sadly. For example, one case in particular I can tell you about in Toronto, a gentleman who lives with Parkinson's. He's out in his backyard. He loses his balance, gets disoriented. He falls down, hits his head on a rock. Now he's conscious, but he's stuck between this rock and a fence. His wife finds him, calls the ambulance. They take him to the hospital. While he's in the hospital, even though all he had was a concussion, which was not a good thing, but he didn't break any bones. During the month that he was in the hospital, he contracted pneumonia and he passed away from pneumonia. But, tracing things back though, what was the trigger? What was the cause? Well, it was a fall. It was lack of appropriate balance and stability. He went down, he fell, his head had to go to the hospital, got pneumonia. A month later, he passed away. Very, very sad. So we want to avoid falling at all costs. And that's one of the main things we work on in this course later on, is to teach intervention strategies and techniques to help improve balance, movement, agility, stability, and reduce fall and fall risk. Okay, so when we look at the health movement spectrum, this is something I sort of made up myself. On the left side, you're going to see that, in fact, I just came from a house of a gentleman who didn't think he didn't believe in his ability to move. Yet, when we got him up, and he lives with Parkinson's, he's 80 years old, a wonderful man, but he didn't think he's going to get up today and move because he just didn't believe that he could. However, we got him up, and his actual ability to move was good. He moved, not as well as I've seen him move before, but he moved much better than he thought he would. Okay, so this is very important. We also want to take a look at the fall awareness spectrum. Now, I'm just going to bring up all the points here, okay? And here's what it is. Okay. When we look here, we see that on the left, there are people who actually overestimate their risk of falling, all right? For example, the gentleman I was with earlier, like an hour ago. He doesn't have fall phobia necessarily, but some people do have fall phobia. They're so afraid of falling that they tend to live a more sedentary lifestyle. Well, this is no good. All right. So this exists out there. We know there are people who are so afraid of falling that they have a phobia of falling. So they live more sedentary lifestyle, and their actual risk of falling, though, is much less than they think in their mind. All right. Now, that's one awareness. Their awareness of falling is not accurate. Yet we also have the other side of it too. And I can remember a particular lady, this wonderful lady in her, late 80s, moves very, very well. However, her confidence, it's a good thing, always nice to have confidence, but she underestimated her risk of falling. In fact, she fits into the category of a person who actually lives with and moves with reckless gait. Okay, this is an actual thing. Reckless gait, where they underestimate the risk of falling. They don't think they're going to fall. They take part in higher risk activities, and the risk of falling increases. And usually in the case of the lady I'm thinking of, well, she had many falls, and one of them was horrible, hit the back of her head, falling backwards hit it on a curb. But she was also doing something she really shouldn't have done, because she is more prone to falling than she thought she is. Okay, so with that said, realize that every person is going to fall somewhere within this spectrum, and maybe they're dead center. Okay, if you look and see the cursor here in the middle, the arrow, boom. We want our awareness to be as close as possible to dead on accurate as to the risk we have of falling. All right, so there's actually a test, an assessment, the fall awareness assessment, which is via the activity specific balance confidence scale, or the ABC scale. So you can Google it, probably easier than anything, and just find it. And it's a self-administered test. The person with Parkinson's, or the person at risk of falling, whoever it is, where it doesn't have to be Parkinson's, could just be somebody with poor balance. It takes this test. It's just on a piece of paper. You print it out. I can't remember how many questions, 14, 16 questions. And then there will be a scoring system. You add up the score, and the score at the bottom is going to give this person a good idea of their awareness of their likelihood of falling. All right, so it's a real good assessment, and I highly recommend checking it out.